Hello and welcome to a very short, interesting discussion on the blood supply of the whole body, where we're going to look at the arterial blood supply as well as the venous drainage. And don't forget to like, comment, and subscribe. So you'd remember that from your thorax anatomy, you say that exiting the left ventricle was going to be an ascending aorta, which is going to give off two very important branches for the heart, which is the left coronary artery and the right coronary artery. And you'd also remember that the right coronary artery would actually originate from the right anterior aortic sinus, whereas the left coronary artery would arise from the left posterior aortic sinus, right? And the left coronary artery will then give you a circumflex branch and an anterior interventricular artery, whereas the right one will actually give you the marginal artery, the conus artery, also give you atrial and ventricular branches. And in 90% of the population, it was going to continue as the posterior interventricular artery, which would actually end by anastomosing with a branch that is coming from the circumflex from the left, which then allows for anastomosis between the right and the left coronary arteries. But you also once, or you'd gone on to say that the coronary arteries are actually functional end arteries, meaning that they're actually going to anastomose, but the anastomosis is not going to be effective. Unlike arteries like the appendicular artery for the appendix, which is an anatomic end artery simply because it doesn't have any anastomosis whatsoever with any of the arteries, right? Then from the ascending aorta, you'd get to the arc of the aorta, which starts at the sternal angle and ends at the sternal angle. The arc of the aorta on the right side would give off a brachiocephalic trunk, and then it would give off the left common carotid and the left subclavian artery. The brachiocephalic trunk would divide into the right subclavian and the right common carotid behind the right sternoclavicular joints at the root of the neck. Right. So if you look at the subclavian arteries are then going to be the principal arteries for the upper limb. But on top of supplying the upper limb, they also supply the thoracic wall, they also supply the head and neck structures as well as the brain through some of its branches. Right? And you'd also remember that the subclavian arteries are actually going to be divided into three parts by a muscle, which is going to be the anterior scalene muscle. If you also remember your rib anatomy, on the first rib, there was going to be a scalene tubercle which separates the subclavian vein anteriorly from the subclavian artery posteriorly. That subclavian artery would be divided into three parts by that very same muscle which is inserting onto the scalene tubercle, which is the scalene anterior muscle. Right. And this subclavian artery, as rightfully said, it has three parts, and each part will give you branches, right? So for the first part, you have internal thoracic artery, which runs a finger breadth lateral to the sternum. The internal thoracic artery will give off the anterior intercostal arteries for the upper six intercostal spaces. Then at the level of the sixth, it will divide into superior epigastric, which we're going to see going into the rectus sheath to anastomose with the inferior epigastric. Then they end up actually supplying the anterior abdominal wall. Then it also gives off the musculophrenic artery, which is going to give the anterior intercostal arteries for the lower five intercostal spaces. From its name, musculophrenic, so it's also going to go to the diaphragm phrenic there. But before dividing, the internal thoracic artery will also give you other branches, for example, the pericardicophrenic arteries, right? I'll come back to it. Then you also get the vertebral artery. Then you get the thyrocervical trunk. Thyrocervical trunk, it's a trunk, so it's going to give you three further branches, right? The branches that you're actually then going to get from the thyrocervical trunk will be the inferior thyroid artery, which will give blood supply, of course, to the thyroid, as well as other head and neck structures, as well as to include the larynx and the pharynx. Then it also gives blood supply to the upper two-thirds of the trachea. It also gives blood supply to the upper third of the esophagus, the inferior thyroid artery, which is coming from the thyrocervical trunk. Then you have the transverse cervical artery. Then you also have the suprascapular artery. Interestingly, the costocervical trunk on the left side, it's a branch of the first part of the subclavian artery. Then on the right side, it emerges on the second part. Right? Then from the third part, you talk of the dorsal scapular artery. Right? The dorsal scapular artery, when it's present, you'd actually realize that it replaces an artery known as the transverse cervical artery, its deep branch, which normally would have expected to have from the thyrocervical trunk. Right? So that's basically the branches that you get from the subclavian artery. Of importance there will be the vertebral artery. The vertebral artery will have 4 parts. There's a part that is in the neck. Then there's a part that goes into the foramen transversarium of the upper 6 cervical vertebra. It doesn't pass through the foramen transversarium of the 7th because it's quite small, and it only allows for passage of the vertebral veins. So the second part lies in the foramen transversarium. Then the third part of the vertebral artery would actually find it in the suboccipital triangle. Then the fourth part is the one that then goes into the cranium to form the basilar arteries, where you now have the two vertebral arteries joining to form a single basilar artery, right, at the lower border of the pons. Right. That's when you then form the basilar artery, which then gives you pontine branches. Then it also gives you anterior and inferior cerebellar arteries, superior cerebellar arteries, the labyrinthine artery for the internal ear. Then it then divides to give you the posterior cerebral arteries, which take part in the formation of the sac of Willis. Then before they join, these vertebral arteries will actually give you branches. Right? And in the neck, they give you spinal branches. Right? They also give you muscular branches. And if you then look at the cranial cavity, they give you branches to the meninges, which is the dura. Right? They also give you the posterior spinal artery, the anterior spinal artery. You also expect a very important artery known as pica, posterior inferior cerebellar artery, which when infarcted would lead to Wallenberg syndrome or lateral medullary syndrome, whereas the anterior spinal artery, if infarcted or blocked, it would lead to medial medullary syndrome. Right? Then you also get medullary branches. And there's something called subclavian Stool syndrome. In subclavian Stool syndrome, you'd remember that if you have obstruction in the subclavian artery before the origin of the vertebral artery, you actually steal the blood from the upper limb to go up to the vertebral artery to preserve the brain. And that is what we'll call the subclavian Stool syndrome, right? Then our internal thoracic artery, we say that it would run a finger breadth lateral to the sternum, and it would give those anterior intercostal spaces blood, then divide into musculophrenic and superior epigastric. But this artery used to also be called the internal mammary artery. So it also supplies the breast tissue. And this internal mammary artery, in supplying the breast, it's going to be helped by arteries that come from the second part of the axillary artery, which is going to be thoracoacromial and the lateral thoracic arteries. Right? So that's your internal thoracic artery or your internal mammary artery. Right? Then the thyrocervical trunk, I told you that it's going to give you 3 branches: inferior thyroid, it would give you superior cervical, it would also give you the suprascapular artery. Right? Then the inferior thyroid, we say, it would actually give branches to the thyroid gland. Right? Then it also gives off an ascending cervical artery. It also gives off the inferior laryngeal artery. Then it also gives you tracheal branches, esophageal branches, pharyngeal branches. For the trachea, upper 2/3. For the esophagus, it's the upper third. Right? Then you also have transverse cervical and suprascapular arteries coming from coming from your thyrocervical trunk. Right. The suprascapular artery of importance, it's going to take part in the formation of an anastomosis that I'm going to mention with the blood supply of the upper limb, which is around the scapula. Right. That is going to be the scapular anastomosis. Then if you look at the costocervical trunk, we say it on the left side, it's going to be a branch of the first part, then on the right side, it's a branch of the second part. I won't bore you with such details, but what's more essential to remember is that it's going to give you branches. So it gives off the deep cervical artery, and it also gives off the superior intercostal artery, right? And that superior intercostal artery is known as also the ascending intercostal artery, right? And it gives blood supply to the upper two posterior intercostal spaces. Right. Then the lower 9 posterior intercostal spaces, they'll receive blood supply directly from the descending aorta. Right. Then I mentioned that from the third part, you'd have the dorsal scapular artery, which takes part in the formation of the scapular anastomosis as well, which we're going to mention with the blood supply of the upper limb. Right. So basically that's the subclavian arteries. The left one coming directly from the arc of the aorta. The right one, we said it would come from the brachiocephalic trunk behind the sternoclavicular joint on the right side. And at the outer border of the first rib, you'd expect the subclavian artery to then become the axillary artery. Right. The axillary artery will be found in the axilla, and that axillary artery, it's going to be divided into 3 parts by a muscle, which is going to be the pectoralis minor. Right. The pectoralis, the first part of the axillary artery is the one that will lie proximal to the pec minor. Then the second part lies deep to the muscle. The third part lies distal to the muscle. Right. And the vein or the axillary vein will always lie medial to your axillary artery, right? And in terms of branches, the first part will give you 1 branch. The second part will give you 2 branches. The third part will give you 3 branches, right? So the first part gives you the superior thoracic artery, right, which is quite a very small branch. And it gives off branches that go to the medial wall of the axilla, as well as the pec major and the pec minor, right? Then from the second part, you have the thoracoacromial artery and the lateral thoracic artery. And if you remember, earlier on I said branches from the second part of the axillary artery will supply the breast tissue together with the internal thoracic artery, which we also called the internal mammary artery, right? The thoracoacromial artery will give you 4 branches that are named. It is the pectoral branches. Then it also gives off the deltoid branches, the acromial branches, as well as a clavicular branch. Right. Then the lateral thoracic artery is quite large in females. It actually supplies the breast tissue, as I said earlier on. Right. And the third part, I said it is 3 branches. So the first one is the subscapular artery, which is actually the largest branch of the axillary artery. The subscapular artery is so named because it runs on the lower border of the subscapularis muscle, and it's going to end towards the inferior angle of the scapula. Right. That's your subscapular artery, and it then gives off a very important branch known as the circumflex scapular artery. And when you look at the very important spaces that you find in the upper limb, you talk of a quadrangular space, a triangular space, and a triangular interval. The circumflex scapular artery, which we're saying is a branch of the subscapular artery, is the artery that we find in your triangular space, right? Then the other 2 branches will be the anterior circumflex humeral artery and the posterior circumflex humeral artery. These are also the other two branches from the third part of the axillary artery. And if you look at the posterior humerocircumflex artery, it's actually larger than the anterior humerocircumflex artery. And they're all going to wind around the surgical neck of the humerus. And if you look at the posterior humerocircumflex artery, it travels together with the axillary nerve in the quadrangular space, right? Then there is going to be an anastomosis around the scapula, which we call a scapular anastomosis. There's one which is around the body of the scapula. Then you have one that is going to be over the acromion process, right? So the one around the body, you expect the suprascapular artery, which we said comes from the thyrocervical trunk, which we said was a trunk coming from the first part of the subclavian artery, right? Then you also have the circumflex scapular artery, which I've just said is a branch of the subscapular artery, which is the largest branch of the axillary artery, right? Then you also have the deep branch of the transverse cervical artery, right? Then the anastomosis that lies over the acromion process, you have acromial branches of thoracoacromial, suprascapular, posterior humeral circumflex, right? The scapular anastomosis is important because it provides a collateral circulation for the upper limb if you have blockage along the vessels. So that is between the first part of the subclavian and the third part of the axillary artery. If you have blockage anywhere along the way, you can have formation of a collateral circulation, right? Then as for the third part of the axillary artery, at the lower border of the teres major, it will then continue as the brachial artery, which will be the artery of the anterior arm. The brachial artery will be superficial throughout its whole course, being covered by skin, superficial fascia, and it's going to give off branches, muscular branches, then it gives off the profunda brachii. The profunda brachii artery will be the artery that you find in the posterior arm. It's going to travel with a radial nerve in the spiral groove in the triangular interval, right, which is simply a space between the triceps. Then the biceps muscle will be also receiving branches from this. So the coracobrachialis, so will be the brachialis muscle, which are simply the muscles that you find in the anterior arm. Then the brachial artery divides in the cubital fossa to give you a larger ulnar artery and a smaller radial artery at the level of the neck of your radius, right? Then if you look at the radial artery, then continues all the way to the hand, where it then passes in your anatomic snuff box, then passes between the two heads of the first dorsal interosseous, then passes through the two heads of the adductor pollicis, which is going to be the same course that you expect for the dorsalis pedis artery when you look at the foot. And after doing that, it's going to form the deep palmar arc, which is completed on the medial side by the ulnar artery. The ulnar artery, on the other hand, immediately after being given off, it gives off the common interosseous artery, which will give us an anterior interosseous and a posterior interosseous artery, right? Then the ulnar artery, when it gets to the hand, it forms mainly the superficial palmar arc, which will be completed on the lateral side by your radial artery, right? Then you also expect collateral arteries from the brachial artery, superior ulnar collateral, inferior ulnar collateral. You also expect recurring branches from both the radial and the ulnar artery, which will form an anastomosis around the elbow joint, right? Coming back now to the arc of the aorta, we also give off the common carotids, remember, right? And the common carotids, they're the chief arteries for the head and neck, right? And so you have a right common carotid and a left common carotid. And quite important will be the carotid pulse, right? And you also remember that the common carotid artery can be compressed against the anterior tubercle on the transverse process of C6, cervical vertebra number 6, known as Chasegnex tubercle. Right. So the common carotids divide to give external carotid and internal carotid. Right. The external carotid is basically the artery of the head and neck, and it gives off branches. The branches of the external carotid, the first branch, which comes from its anterior surface, will be the superior thyroid artery. Remember, we said the inferior thyroid artery was going to be a branch of thyrocervical trunk, which is coming from the first part of the subclavian artery. Right? So that's superior thyroid artery. It gives you an infrahyoid branch for the infrahyoid muscles. It gives off the stenomastoid branch for the sternocleidomastoid. It also gives you the superior laryngeal artery, which will travel with the internal laryngeal nerve. It also gives you glandular branches. Right? Then the next branch will be the lingual. The lingual artery, from its name, lingual means tongue. Right? It also arises from the anterior aspect of your external carotid artery. Right? Then it supplies the tongue as well as oral cavity structures. Then you have the facial artery, which also arises from the anterior aspect. Right? The facial artery used to be called the external maxillary artery, rather, not mammillary, external maxillary artery. That's your facial artery, and it gives you branches like superior labial, inferior labial, and you remember that the superior labial artery would take part in the formation of the Carotid Anastomosis in Litus area on the medial nasal septum, together with the anterior ethmoidal artery, posterior ethmoidal artery, which are branches of the ophthalmic. Then you also look at the sphenopalatine artery and the greater palatine artery, which are branches of the maxillary artery, which we are going to see as one of the terminal branches of this external carotid artery. Right. So that's your facial artery. Then it's the main artery of the face. It supplies the muscles of facial expression. It has a tortuous course. It's not straight, because if you're then going to smile like I'm doing right now, it may not end well, right? Then you have the occipital artery, which arises from the posterior aspect of the external carotid artery. The occipital artery will supply the scalp behind the auricle. And if you remember your triangles quite well, you find it in the upper part of the posterior triangle of the neck, which lies above the inferior belly of the omohyoid muscle, and that is going to be the occipital triangle. This occipital artery, it will give you branches that go to the sternocleidomastoid, the meninges, the scalp, just to mention a few. Right. Then you have the posterior auricular artery, which also arises from the posterior aspect of the artery, right? And it also supplies the scalp behind the auricle, and it also supplies the auricle itself. So it gives off auricular branches that supply the auricle, right? Then there's the ascending pharyngeal artery, which originates from the medial surface of the external carotid artery. From its name, ascending pharyngeal, it will give branches that go to the pharynx, and also gives meningeal branches that go to the meninges. It also gives you branches for the palate as well as branches to the ear, right? Then it terminates this external carotid artery by giving off the superficial temporal artery and the maxillary arteries, right? So if you look at superficial temporal, that's the smaller terminal branch, but it's the more direct terminal branch in terms of continuity with this external carotid artery, right? The branches from the superficial temporal, the most important is the transverse facial artery, which runs forward on the anterior border of the masseter here to supply the face as well. It also gives you auricular branches, a zygomatic orbital branch, as well as giving you some deep temporal arteries, which supply the temporalis muscle, one of the muscles of mastication. Then it also gives you some posterior parietal branches, right? Then you can also get the superficial temporal pulse in this region from that artery, right? Then there's what is known as the maxillary artery. The maxillary artery is going to be the artery of the infratemporal fossa. And in the infratemporal fossa, the maxillary artery will be divided into three parts. By the landmark muscle of the infratemporal fossa, which is going to be the lateral pterygoid muscle, right? So if you look at the first part of the maxillary artery, it gives you 5 branches. That is midmeningeal artery, which then passes through the foramen spinosum. That is going to be the midmeningeal artery. You also get an anterior tympanic artery, which passes through the petrotympanic fissure. Then you also get the deep auricular artery, which passes through your squamotympanic fissure. Then you also get an accessory meningeal artery, which passes through the foramen ovale in company of V3, lesser petrosal nerve, and Anesuishe vein. Then you also get a myeloid artery coming off the inferior alveolar artery, which is the other branch from the first part, right? The second part gives you muscular arteries. So there's deep temporal arteries, you have muscular branches for the lateral pterygoid, the medial pterygoid, and the masseter, so the mesenteric vessels. So you basically get branches to the muscles of mastication from the second part of the maxillary artery. Then from the third part, you get pharyngeal branches, you get greater palatine and lesser palatine branches, phenopalatine branches, posterior superior alveolar branches, right? And an artery for the pterygoid canal, right? So basically that's what you get from the maxillary artery, right? That's the larger terminal branch of the external carotid artery, right? Then coming back to common carotid, the internal carotid is the other terminal branch from the common carotid, right? And it's the one that is more direct in terms of continuity, right? And this is the principal artery for the brain and the eye, this internal carotid artery. It's going to have a cervical part, which I won't dwell much on, because it's going to be pretty much useless. Then there's a petrous part, right? The petrous part of the internal carotid artery is where it lies in a carotid canal, right? Then remember, from the carotid canal, it emerges on the apex of the temporal bone, on the posterior wall of the foramen lacerum as it passes upwards and into the upper part of the cranial cavity to enter the cavernous sinus, right? In the petrous part, gives you caroticotympanic branches, which go to the middle ear. Remember, you're going to find the internal carotid artery on the anterior aspect of the middle ear, right? So surrounded by a plexus of nerves that are going to form the deep petrosal nerve, which will join the greater petrosal nerve to form the nerve of the pterygoid canal, right? So it gives off those caroticotympanic branches as well as pterygoid branches, right? Then the cavernous part is the one that lies within the cavernous sinus, right? So internal carotid artery will travel within the cavernous sinus in company of cranial nerve number 6, which is going to be the adjacent nerve. And also remember that in the lateral wall of the cavernous sinus, you expect to have cranial nerves number 3, number 4, V1, and V2, right? In the cavernous sinus, it gives you cavernous branches that go to the trigeminal ganglion. It also gives you hypophyseal arteries, a superior and an inferior hypophyseal artery for the hypophysis itself, which is the pituitary gland. Then there's the cerebral part, right? And the cerebral part, remember, that's where it's going to terminate by giving you anterior and middle cerebral arteries. The anterior and the middle cerebral arteries are going to be the principal arteries of the brain, together with posterior cerebral that I said was going to be the terminal branches from the basilar artery. So here's what happens. The two anterior cerebral arteries are joined by an anterior communicating artery. Then the anterior cerebral arteries will be joined to the posterior cerebral arteries by a posterior communicating artery. Those arteries will form the sac of Willis, plus the internal carotid and the basilar artery. The middle cerebral artery will not take part in the formation of the sac of Willis. The middle cerebral artery will mainly supply the lateral surfaces of the brain, the lateral hemisphere, except the upper parts of the lateral side and the medial part, which will be supplied by anterior cerebral. Then posterior cerebral will mainly supply the occipital cortex. Right. Then the cerebral part also gives off the ophthalmic artery, which will be the principal artery of the eye. Importantly, the ophthalmic artery will give you this, the central artery of the retina, right? And damage to that will lead to blindness. Then you also get anterior choroidal arteries, which will be going to the choroid plexuses, right? That's basically the arterial supply of the upper part, right, from the blood. The veins will follow the arteries with a few exceptions. For example, the internal thoracic veins would drain into the brachiocephalic veins on either side, yet the arteries were coming from your first part of the subclavian. So from the head and neck, you have the internal jugular vein, which is formed as a continuation of the sigmoid sinus of the brain and passes through the jugular foramen. It's going to be on the floor of the middle ear. So what happens is, external carotid artery, we said it divides into maxillary and superficial temporal. The corresponding veins join in the parotid and they give you the retromandibular vein. The posterior division of the retromandibular vein plus the posterior auricular vein, they join to form your external jugular vein. Then the anterior division joins the facial vein, then they form a common facial vein. Common facial vein drains into your internal jugular vein, right? Then the external jugular vein will drain into the subclavian vein. Then subclavian vein plus internal jugular vein, they'll form the brachiocephalic veins. The left brachiocephalic vein will cross to the right to join the right brachiocephalic vein and form the superior vena cava at the level of the first costal cartilage. The very same superior vena cava will then pierce the fibrous pericardium of the heart at the level of the second costal cartilage. Then it would then enter the heart at the level of the third costal cartilage. If you remember quite well, the right border of the heart starts about 1.3 centimeters from the sternum, adjacent to the third right costal cartilage. So it makes sense to also say that the superior vena cava drains into the heart at the level of the third right costal cartilage, approximately 1.3 centimeters away from the sternum. Right. Then, of course, coming from the lower limb, you have upper limb rather, you have superficial veins like cephalic vein and basilic vein, which are formed from the dorsal venous arc. In the roof of the anatomic snuff box on the lateral side, we find the cephalic vein. On the medial side, we find the basilic vein. Cephalic vein will be superficial throughout its whole course. Then it drains into the axillary vein. Then basilic vein at the elbow joint, it pierces the deep fascia to join the vena comitatus of the brachial artery. Then they form the axillary vein at the level of the lower border of the teres major. The axillary vein is the outer border of the first rib. It will become the subclavian vein, which we just said would join the internal jugular veins to form the brachiocephalic veins. Right. Then, if you look at the arc of the aorta, it continues downward as the descending thoracic aorta, which we said was going to give you esophageal branches for the middle third of the esophagus. It also gives you branches to mediastinal structures, posterior intercostal arteries for the lower 9 intercostal spaces, right? Then it passes through the aortic opening in the diaphragm at the level of T12. where it then becomes the abdominal aorta. Right. Then of importance, the venous side, there's a vein called the azygous vein in the thorax. The azygous vein is formed on the right side by a union of the right subcostal vein and the right ascending lumbar vein. This right azygous vein at the level of T8, it receives the inferior hemiazygous, which is formed by the corresponding veins on the left, which is left subcostal, left ascending lumbar. Then at the level of T7, it receives the superior hemiazygous. Then after arcing over the root of the right lung, it drains into the superior vena cava at the level of T5. And the arc of the aorta actually arcs over the root of the left lung. The azygous vein arcs over the root of the right lung. The azygous vein passes through the very same opening that the aorta passes through in the diaphragm, which is the aortic opening. Right. Then for the purpose of the abdomen, the abdominal aorta will give you 3 anterior visceral branches. The 3 anterior visceral branches of the abdominal aorta will be the celiac trunk at the level of T12, superior mesenteric at the level of L1, which coincides with the transpyloric plane. Then inferior mesenteric artery at the level of L3, which coincides with the subcostal plane. The celiac trunk will be the artery of the foregut, and it gives you 3 branches. There's the left gastric artery, which supplies basically the upper part of the lesser cavity of the stomach and the lower third of the esophagus. Then it also gives you the splenic artery, which is the largest branch of your celiac trunk. Splenic artery lies on the stomach bed, lies on the upper border of the pancreas, to which it gives off branches. Then before entering the hilum of the spleen, the splenic artery will give you the short gastric arteries, which supply the fundus of the stomach. It also gives you the left gastroepiploic arteries that supply the upper part of the greater curvature. Those arteries will travel in the gastrosplenic ligament. Then your splenic artery will then go into the spleen and divide into the trabecular arteries, which give you central arterioles. Then the central arterioles will then, of course, be covered by the periarteriolar lymphoid sheaths. Then they'll have an open circulation for removal of old red blood cells, as well as the closed circulation to fight off infections, right? Mainly encapsulated organisms. Then the third branch from the celiac trunk will be the common hepatic artery. The common hepatic artery gives off the right gastric artery for the lower part of the lesser curvature. It also gives off a gastroduodenal artery and the hepatic artery proper. The hepatic artery proper will be for the liver, and it will divide into a right hepatic artery and a left hepatic artery. The right hepatic artery will also give the cystic artery, which is the artery of the gallbladder. Then the gastroduodenal artery is quite a large artery. It travels behind the first part of the duodenum, meaning duodenal ulcers can actually ulcerate the posterior wall and affect this large artery, leading to intra-abdominal bleeding. Then this gastroduodenal artery gives you superior pancreaticoduodenal artery for the foregut part of the duodenum and the upper part of the pancreas. Then the gastroduodenal artery will also give you the right gastroepiploic artery for basically the lower part of the greater curvature. Then for midgut structures, you rely mostly on the superior mesenteric artery, which gives off the inferior pancreaticoduodenal artery. The name is self-explanatory. It also gives off iliac and jejunal branches. One of the differences that you'd noted between the jejunum and the ilium was the fact that the jejunum was going to have fewer arcades but longer infrequent branches, which you frequently call vasa recta. Then the ilium would have many arcades but shorter branches. The superior mesenteric artery also gives you other arteries for midgut structures like ileocolic. It also gives off the right colic and the meducolic arteries. The ileocolic arteries of importance would give you the anterior cecal and the posterior cecal arteries. The posterior cecal artery will also give off the appendicular artery for the appendix. This is an anatomic end artery without any anastomosis with the other blood vessels. Right? Meaning gangrene of the appendix is quite common. Right? Then for the hindgut, you have inferior mesenteric artery. Inferior mesenteric artery will basically supply the hindgut, gives off the left colic artery, sigmoid branches, then continues, of course, as the superior rectal artery. I'll mention where the middle rectal and the inferior rectal arteries come from when we do the artery of the pelvis, but basically that would be internal iliac and the internal pudendal vessels, respectively. Right. Then, so those are the three unpaired visceral branches. The aorta or abdominal aorta will also have three paired lateral visceral branches. There is the ovarian artery or testicular artery. Those are the gonadal vessels. They are the renal vessels for the kidney. Then you also have the suprarenal vessels. The suprarenal gland, funny enough, it has three arteries but one vein. The three arteries will be, one comes off the inferior phrenic, the other one is the suprarenal artery, which I just said comes directly from the aorta. Then the other one will be a branch from the renal artery, right? But for the veins, they only have one vein. That for the left will drain into left renal vein. That for the right will drain into the inferior vena cava. That's the same drainage for the testis and the ovary. Right? And the abdominal aorta will also have three, or not three, but five. The three is for the terminal, I'll come back to it, but five lateral abdominal wall branches, four lumbar arteries, and an inferior phrenic artery to make them five. Then the three terminal branches, you have the right common iliac, left common iliac, as well as a median sacral artery, which will be going to the bladder. I'll come back to the common iliac arteries shortly. For the purpose of the veins in the abdomen, you find the inferior vena cava on the right side of the aorta. It also has three lateral visceral tributaries. So it only has the right gonadal vessels. The left ones, remember, they go to the left renal vein. It also has right suprarenal vein. The left one goes to left renal vein. Then the renal veins, of course, the left and the right, will then ultimately drain into the inferior vena cava, which passes behind the liver, embedded in it, and forming the right marginal boundary of the caudate lobe on the liver, if you remember that. Then it also receives the hepatic veins from the liver, hence giving the liver its major stability or support. Right? Then the veins from the gut, which is superior mesenteric and the splenic vein, they join to form what is known as the hepatic portal vein at the level or behind the neck of the pancreas, which is at the transpyloric plane. At the same time, the inferior mesenteric vein, which is formed as a continuation of the superior rectal vein, rather. This inferior mesenteric vein is formed as a continuation of superior rectal vein. It's going to join the splenic vein behind the body of the pancreas. Splenic vein will then join superior mesenteric vein to form the hepatic portal vein, which feeds directly to the liver. It gives the liver 70% of its blood supply, whereas the hepatic artery proper gives off 30%. From your histology, you'd also then remember that you then talk of what is known as hepatic acinus, where you then talk of zone 1, zone 2, zone 3 to describe the fact now that oxygenation will be an issue in the liver because of that 30%, right? Then you also have veins from the foregut, like the right gastric vein, the left gastric vein. They'll be feeding directly to the portal vein, as well as your cystic vein for the gallbladder, right? Then they're what are known as portal cava or systemic venous anastomosis. They are occurring at 5 sites. One is in the lower esophagus between the left gastric veins, which drain the lower third of the esophagus, and the azygous veins, which drain the middle third. The other one is in the lower half of the anal canal, where you expect superior rectal vein, middle rectal veins, and the inferior rectal veins. The other one is around the umbilicus, which clinically presents as a caput medusa, where you have the paraumbilical veins and the superior epigastric veins. Then the other one is around the liver, around the Bay area, where you have the intrahepatic veins of Sapi communicating with the veins in the posterior mediastinum. Then you also have a retroperitoneal one, where you have veins of the large intestines communicating with the renal veins and so forth. Right. Basically, that sums up a very short summary for the abdominal blood supply. Then moving on, we'll then look at the common iliac vessels. Remember, we said the aorta would end at L4 into those two common iliacs, right? And the median sacral artery. The common iliac arteries will divide at the pelvic brim. Then they'll give off the internal iliac for the pelvis and perineum. Then it gives off the external iliac, which continues the lower limb as the femoral artery. But before the external iliac goes to the lower limb, it gives off inferior epigastric. It also gives off the deep circumflex iliac arteries. Then we'll talk about the femoral artery later on. Then the internal iliac in the pelvis, it divides into an anterior division and a posterior division. The posterior division gives you 3 branches. The rest come from the anterior division. The 3 branches from the posterior division will be the iliolumbar, the lateral sacral, as well as the superior gluteal artery. Then the posterior division gives you vaginal artery for the vagina, uterine artery for the uterus, inferior gluteal artery, gluteal region, then inferior internal pudental, midrectal, then you have inferior vesical, obturator artery as well, which you're going to see on the medial thigh. Then you have your umbilical artery, which gives you the artery with the vas deferens, which is one of the contents of the spermatic cord. Then superior vesical artery, which supplies the blood as well as the ureter. The ureter, you'd remember that it is a unique blood supply which resembles that of the esophagus, where you have 3 blood vessels in each for each third. The upper third, you have the upper third, you have the renal vessels, middle third, you have the gonadal vessels, and the lower third, you have your superior vesical arteries, basically, right? Then you'd also remember that the median sacral artery will be the smaller branch that comes off the bifurcation of the aorta, and it actually descends anterior on the anterior surface of the sacrum and the coccyx, right? Then the veins will follow the arteries. The external iliac veins will join the internal iliac veins. They form the common iliac veins, which join at the level of L5 on the right side to form the inferior vena cava, which will pierce the cava opening in the diaphragm in the level of T8, then go to drain into the right atrium as well, right? Then coming back now, external iliac, after crossing your inguinal ligament, it becomes the femoral artery, which will occupy the most lateral compartment of the femoral sheath. Femoral sheath, which was formed as a continuation of fascia iliaca and transversalis fascia. The femoral artery gives off superficial external pudendal, superficial epigastric, superficial circumflex iliac arteries, right? It also gives off the profunda femoris artery, whilst in that femoral triangle, which arises from the posterolateral aspect of the artery, unlike the profunda brachia in the arm, which arises from the posteromedial aspect. Right. The profunda femoris artery gives you lateral femoral circumflex and the medial femoral circumflex arteries, which take part in the formation of the cruciate and trochanteric anastomosis. The difference between those two anastomoses is just one artery. So they each have 4 arteries. Trochanteric anastomosis will have superior gluteal, inferior gluteal. Then it also has medial femoral circumflex, then lateral femoral circumflex. For the cruciate anastomosis, you simply then subtract the superior gluteal artery, then you add the first perforating artery of the profunda femoris. So the lateral femoral circumflex and the medial femoral circumflex will help give blood supply to the medial compartment of the thigh, where they will be helped by the obturator artery, which we just saw coming from the internal iliac. Right. Then perforating arteries, though there are 4 of them from this profunda femoris, they'll supply the posterior thigh. Right. Then the pulse for the femoral artery, remember you find it at the mid-inguinal point, midway between the ASIS, your anterior superior iliac spine, and the symphysis pubis. Right. The lobular artery is an anterior branch and a posterior branch. The posterior branch will also go and give blood supply to some of the muscles that you find in the gluteal region. Right. Then for the purpose of the leg, remember the femoral arteries will continue as the popliteal arteries in the popliteal fossa, which divide the lower border of the popliteus to give you a larger posterior tibial and then a smaller anterior tibial. The anterior tibial will give blood supply to the anterior leg, and it continues as the dorsalis pedis on the dorsum of the foot, which I earlier on said is the same cause as basically the radial artery. It will pass between the two heads of the first dorsal interosseous, then it's going to pass through the two heads of the adductor hallucis to complete the plantar arc, which we're going to see being formed by the lateral plantar artery. Then your posterior tibial artery will give off the fibular artery, which is the peroneal artery for the lateral compartment of the leg. And it then divides into medial plantar and lateral plantar for the sole of the foot. The lateral plantar artery, on reaching the fifth metatarsal, it arcs medially to form a plantar arc, which is completed on the medial side by the dorsalis pedis artery, the one that I've just mentioned. Right. Then you can get an aneurysm in the popliteal artery, which can result in absent plantar flexion. Right. Then for the veins, they'll simply follow the arteries. But what's more important is to remember the fact that you have superficial veins, just like those in the upper limb. There's a great saphenous vein which travels with the saphenous nerve. The great saphenous vein and the saphenous nerve travel in front of the medial malleolus, and it travels all the way up to enter the saphenous opening to drain into the femoral vein. Whilst on the lateral side, there is a small saphenous vein or a short saphenous vein, which travels with the pseudo nerve behind the lateral malleolus, another level of the knee joint, just like the basilic, upper limb. This small saphenous vein would then actually drain into the popliteal vein or drain into the great saphenous vein or divide into two, one that will go to the great saphenous and one that will go to the small saphenous vein. I really hope you enjoyed watching this very short summarized session for the blood supply of the whole body.